everyone, and welcome back to the fourth and final day of our C Arthritis event here at the CRA and AHPA annual scientific meeting. We're very excited to be ending off on a super high note with Dr. Anne Yeh. Thank you so much for joining us.
Thanks for having me.
Of course. So we would love to start by asking you to share a little bit about yourself and how you're involved in rheumatology.
Yeah, so I'm actually a neurologist, not a rheumatologist. Should I be looking this way or at you? I can look at you, yeah. So I'm a neurologist, not a rheumatologist, but when I was a resident, I was given the opportunity to learn about the things in children that were related to multiple sclerosis. And when I started learning about those things, I actually realized that most of what I was dealing with was not multiple sclerosis, but other inflammatory problems, and that there was a lot that I could learn from rheumatologists. And so, and so I've ended up taking care of a lot of kids that have a lot in common with conditions, rheumatologic conditions, and have ended up working with rheumatologists a lot.
Right, great. And so as a part of that, you did a session talking about neuroinflammatory disease. And I would love it if you could tell us a bit about that.
Yeah. So what I talked about was really how things have changed in the last decade, where we didn't have a good understanding, and we still don't have a great understanding of these disorders, but there's been much more clarity in the last decade or so in being able to identify different kinds of entities within the larger category of neuroinflammation. And actually some of this has led to being able to treat, where previously we would just say, I don't know what's going on, I'm not sure what to do. We have gained knowledge that has helped us to treat and actually keep disease in pretty good control in a group of these kids.
Wow, that's wonderful.
Yeah, it's exciting.
It is very exciting. So I'd be curious to know what that treatment is like and maybe what the similarities are, as you mentioned, to rheumatological conditions.
Yeah. So when I'm dealing with this inflammation, just like what rheumatologists deal with in the body, and so but the inflammation is inside the brain, the spinal cord, the optic nerve, and other sort of central nervous system locations. So what that means is that I've learned a lot from rheumatologists, and we've learned a lot from rheumatologists in terms of treatments. And many of the treatments that we use are pretty much the same as rheumatologic treatments.
Right,
yes.
Wonderful. And so I also understand that you study neuroinflammatory disease sort of specifically in pediatric population. Can you tell us about that? Maybe how it's different in pediatric population and adult population?
Yeah. So the big thing that's different in pediatrics is, well, there are two big things. One is a lot of kids that have an acute episode of inflammation in the brain or the spinal cord or the optic nerve will never have another episode.
Oh, interesting.
But about, based on what we've seen, 20% to 40% may have further episodes. And those kids with further episodes often are very young. And so, different from the adult population, we're always thinking of other reasons that could be driving the inflammation, meaning underlying genetic abnormalities, and we're always thinking about how we can learn from the work that's been done on systemic rheumatologic conditions. Because sometimes what happens is the kids will start out with something in the brain or in the optic nerve, and ultimately there will be systemic involvement as well.
And then maybe it becomes into JIA, or?
Well, not necessarily JIA, but other conditions. The one thing that we share a lot with rheumatologists are the periodic fever syndromes and other syndromes that may have genetic bases. So and the other group of kids that we share with rheumatologists are ones that have lupus in combination with other things in the central nervous system.
Interesting, right. And what's the prevalence?
Well, it's pretty uncommon to get inflammation of the central nervous system, about 1 to 2 per 100,000. It's of those kids, about 20 to 40% will have recurrent episodes.
Right. Okay, and then tell me about the main challenges that you see faced by this population?
Yeah, so diagnosis
Okay.
is one huge challenge, and we're learning more about that every day. So one of our big challenges has been in the last decade or so differentiating what is going to come back, what's not going to come back, how we can predict what kids need medicines. We've gotten a little better at that. And the second big challenge is knowing what to treat with.
Right.
We have some that where we have very clear diagnoses, and we feel like we can treat pretty well, even if we don't have enough kids in those populations to do big randomized controlled studies. There's such a robust response to therapies that we think we have a kind of handle on that.
Okay.
But there's a huge group of kids that appear to have inflammation who we have trouble understanding what biology is driving it and what medicines are the best medicines to use. And that's where we're going to learn over the next decade.
Yeah. And so with your session, correct me if I'm wrong, but was, maybe part of the intent there that if you can share this knowledge with rheumatologists, that maybe they could see if a patient had this, be able to pick up on the symptoms?
Absolutely, yeah.
Right.
So one of the things that we find, at least in pediatrics, is that many of the kids have things that are difficult to diagnose, and often what happens in a hospital when there's difficulty in diagnosing, all the subspecialists that are in the hospital get asked for their opinions.
Right.
And often there is overlap with neurology and rheumatology in seeing these patients. And so what I hoped that the workshop would help rheumatologists with would be if they were the first persons being asked about these patients, that they could identify some of these syndromes that we've been able to more clearly delineate and be able to help families come to a diagnosis more quickly and really feel confident in what they were seeing.
Right, absolutely. That makes so much sense, and it sounds like that really important session, and hopefully, make some changes going forwards with identification and early diagnosis.
Yeah, I hope so. It's a tough entity to deal with, and we have a lot to learn.
Absolutely. So, as you know, the theme for this meeting is 2020 vision. So, sort of moving forward. So, in your field, where do you hope to see things in the next decade?
Oh well, I hope. So, in a practical sense, I hope we have more therapies for kids.
Right.
And what would drive the therapies is understanding more of the biology that's driving things. And it's become a cliche to talk about precision medicine, personalized medicine, but that's where we are really with this, and I hope to see things going in the next decade, because what we're dealing with in rheumatology and neuroinflammation is very rare disorders, but disorders that have the potential of being treated in a life-altering way.
Right.
So that's where I hope things are going.
Absolutely, and especially, working in pediatrics at such a young age, when these happen, you just even more keen to be able to get that figured out.
Well, absolutely, because what it means, if we can treat these disorders, it means that the children have a lifetime ahead of themselves to have a great life.
Yeah, absolutely. And I'd be curious to know, I know it sounds like you're hoping for more therapies moving forward. For the time being, are therapies mainly pharmacological, or are there other sorts of physio?
Well, yeah, absolutely. So, I mean, it's really important to have rehabilitation alongside the treating the biology, because when the kids that we take care of become quite disabled at the time of their attacks, but they have great potential for rehabilitation, and most, if not all of them, will can return to a close to normal function. So rehabilitation is really important. The other thing that we see a lot is that isn't talked about as much, is that mental health is a huge issue in the kids that we take care of.
Of course.
And whether it's due to the biology itself, or due to the environmental and sort of situational problems related to having an illness. So those things also are really important to address in terms of treatment.
So I know that in rheumatology, there's been some recent sort of understanding that some of the mental health issues faced by patients with inflammatory arthritis could actually be due to the inflammation as well in the brain. Is that the same case in your area?
There's a lot of discussion about that within neurology, absolutely. And because some of what we do actually, when the kids present to us, comes with more serious psychopathology, hallucinations, psychosis, and things like that, really teasing apart what is due to the inflammation and what's due to environment is hard. And so we really take the approach that we need to treat the disease aggressively, and in doing that we may help to improve mental health outcomes too.
Right. Well, something that we know our viewers are always very interested in is to learn about what advice you may have for children and their families living with neuroinflammatory diseases. You can offer any sort of tips or advice, sort of general lifestyle things.
Oh, lifestyle things. Okay, so those are really important.
Right.
And in fact, I would say that that's one of you've hit on it. You know, when families come to see me in clinic, you know, most are agreeable to starting a medication, but the one big thing that they come in wanting to know is there something I can do for my child? Is there something to do? Is it, first of all, they may ask, is it something I did? Did I do something wrong? I know, it's inevitable as a parent that you really want to know if there's something you could have done differently as a parent to have a different outcome in your child. But the other part of it is they say, well, you know, is there something we can do as a family to change our environment, to change our lifestyle and things like that, to improve outcomes? And so, you know, we've spent a lot of time looking at physical activity. Our primary focus has been physical activity in children with multiple sclerosis, but this is true in the rheumatologic population as well, and in our own population. And what we've found is that kids with increased levels of physical activity, who do vigorous activity, who who at least approximate what some of the recommendations are through Canada, have better mental health outcomes, they have less fatigue, and what we found in multiple sclerosis is that their brain outcomes are better as well.
Oh, great.
So physical activity is absolutely important. A balanced diet, I recommend against extreme diets, because a lot of there's a lot out there on the internet, and there are a lot of people out there talking about, you know, about extreme diets that they say will change people's lives. And the research that's been done on diet has not supported taking that kind of an extreme approach. Balanced, healthy diet, social support is really important in families, and physical activity, among other things. Vitamin D.
Well, thank you. Those are all such important points you hit on, and it was really interesting learning about this. I'm just going to go to Anita now and ask if there are any questions from our viewers.
What do you think is the reason for a lack of medication therapies for children living with neuroinflammatory diseases and arthritis?
So the lack of therapies, there are two issues. One of the things is an access issue, because some of the diseases that we take care of are very rare. And because they're rare, it's very difficult to study in a way that would satisfy regulators, and that leads to lack of access. We hope that we're moving towards a different kind of model of understanding how the government will accept therapies, so that kids with rarer disorders can get approval for therapies, and that they can be studied in a different way. But you can't tease apart access from lack of therapies.
And for healthcare professionals, what makes children feel more comfortable in the clinical setting?
Yeah, well, I have to say that children are frequently uncomfortable in the clinical setting, for sure. So what we try to do is to have a family-friendly kind of situation. We hope to make teenagers more comfortable by asking their parents to leave the room so that we can chat about things that might be important to the teens that they don't want to share with their families. And we always try to provide a great deal of support. There's some things we don't have control over. I think children would be more comfortable if we didn't have to test things and to do blood work and things like that. And so we try to minimize the amount of pokes that kids get, but unfortunately sometimes that's something we have to do.
Great. Well, thank you so much for coming in today.
Thank you.
It's been a pleasure. And if we get more questions from our viewers, we'll email them to you. And
Absolutely. I'm happy to answer them
Great.
if you have any questions.
Well, thank you so much. And thank you, everyone, for joining us at the See Arthritis event. It's been lots of fun the past few days, and we'll see you next year.